So one of the most distressing allergy symptoms is feeling like you cannot breathe. So whether you can't breathe through your nose or even through your chest. And sometimes it's because of nasal congestion, which can make it impossible to sleep. Or sometimes it can be from airway restriction, which can be very scary. So if you've ever felt like your nose was completely blocked or you've struggled to take a deep breath, this video is for you. Welcome, I'm Dr. Lola Ashaye. I'm a board-certified family and lifestyle medicine doctor and owner of InTouch Primary Care. And you're listening to Connecting the Dots with Dr. Ashaye. So if you or your loved ones are feeling frustrated with healthcare delays, or you're looking for care that is tailored to your needs, where you get customized care plans, same next day visits, and you feel like your care is valued, your healthcare is valued, our membership program might just be for you. We're committed to making healthcare easy, accessible, and patient-centered. Okay, so let's get right into it. First, let's talk about why allergies make it hard to breathe. So sometimes it's from nasal congestion, like we mentioned, and that happens when your immune system overreacts to the allergens. So allergens can be pollen, it can be dust, it can be pet dander. And as a result of the overreaction, it releases histamines. These histamines cause inflammation in your nose, in your sinuses, and it causes you to have sinus pressure and to feel congested and to have drainage. So sometimes the symptoms get worse at night, and that's because the fluid builds up when you're laying down. So the other reason this happens is sometimes allergens actually trigger airway inflammation. So similar to what happens in asthma, where the airways get inflamed. So because they're inflamed, like if you think about inflammation like swelling or fluid making the airways smaller, so that when the air goes through it, it's noisy, so you're wheezing. You also feel like your chest is tight and sometimes you can't breathe. So up to 40% of people with allergies, like allergic rhinitis, also develop asthma, according to the Journal of Allergy and Clinical Immunology. And in severe cases, some can have anaphylaxis, which is a life-threatening reaction, which requires immediate medical attention. So what can you do? So what can you do if you cannot breathe through your nose? The gold standard is using a nasal steroid spray. So some examples are fluticasone, which is Flonase, mometasone, which is Nasonex, budesonide, which is Rhinocort. So using a steroid intranasally can help reduce the swelling in the nasal passages, and so over time that increases airflow. So there was a study in the American Journal of Allergy and Rhinology that found that nasal corticosteroids, which are nasal steroids, are more effective than oral antihistamine in relieving nasal congestion. So if nasal congestion is your main symptom, then you definitely want to use a nasal spray, like a steroid nasal spray. So there are many different types of nasal sprays, so it's important to check to see if it has a steroid in it. But also be aware that the nasal spray do not act immediately like some of the other, the steroid nasal sprays do not work immediately like some of the antihistamine nasal spray. So you do have to use it for a couple of days to get good relief of symptoms. But it's important to use it consistently so that you can get relief of symptoms. The other thing you can try, which I have found to be very effective when my patients have used it, is a saline nasal rinse. So you can do this with a neti pot or a saline spray, because what it does is flushes out the allergens and it reduces nasal swelling. And there was a study in JAMA that found that patients using daily nasal saline rinses reported 30 to 50% improvement in their allergy symptoms. So it's really important to try it, because I've noticed that a lot of people that do this, and like I said, it's something that you want to do at least daily, clean out your nasal passages if you're struggling with allergies, especially if congestion is a major symptom. You can do this using sterile, distilled, or previously boiled water. Don't use tap water though. And basically, you just lean forward, you tilt your head sideways, and then gently rinse one nostril at a time with the distilled water or sterile water or boiled water that has been cooled. Okay. All right. The next thing that can be helpful is you can take an oral antihistamine if needed on top of doing a nasal steroid. And nasal saline rinses. Some of the non-drowsy options are cetirizine, which is Zyrtec, loratadine, which is Claritin, or fexofenadine, which is Allegra. And what they do is they block the histamine so that it reduces the symptoms that the histamine causes. So a lot of times people will notice that the sneezing decreases, they don't have as much of a runny nose anymore, and it does help with congestion as well. And studies suggest that combining a nasal steroid with an antihistamine provides the best symptom relief for allergic rhinitis. So as you can imagine, you're blocking the histamine with an antihistamine. So some of those things that are supposed to happen because of the overreaction caused by the allergen is not happening. And then you're using a nasal spray to reduce the inflammation, which helps with your symptoms. So both together, very helpful. All right. The other thing that you can do if you're having trouble breathing through your nose is using a humidifier. So you don't want dry air. So you want to, because that will make the congestion worse. So you can use a humidifier to keep your nasal passages from drying out and becoming blocked. Also, trying to drink plenty of fluids, tea, warm fluids especially, can help to thin the mucus. Okay, so that is if nasal congestion is your main symptom. Now, what if you can't breathe because of chest tightness? Well, the first thing you want to do in that scenario is you definitely want to remove yourself from the source of the allergen. And I talked about that last week, so you can grab the last week's video to learn more on some of the things that you need to do to get rid of allergens. You want to go to a well-ventilated area where it's not like you're not in a enclosed space. And you want to try to breathe through your nose. This is assuming your nose is not blocked because you've done all these other things. If you're indoors, you want to turn on an air purifier using a HEPA filter. Okay, so I talked about that last week as well. So all these things are really trying to reduce the allergen exposure. Now, if you may need an inhaler. So for some people with asthma, as I mentioned, many people with allergies will develop asthma as well. And so having a rescue inhaler like albuterol helps because it opens up the airway. So you may need one if you don't have one, or you may need to use the one that you have. Sometimes you would also need a steroid inhaler to reduce inflammation over time. So inhaled steroids are the most effective long-term treatment for allergic asthma. So some people with allergies will definitely also need a steroid inhaler to help with symptoms. Also, breathing exercises can help. And basically, those really help to prevent you from panicking, because when you can't breathe, it can be very scary, right? And so by deeply breathing through your nose for 4 seconds, you hold it for 2 seconds, and then exhale slowly through your mouth, but with your lips pursed. So basically, you take a big deep breath for 4 seconds, you hold it for 2 seconds, and then you exhale slowly like that. And the idea is to try to calm down, because when you're panicked, that doesn't help. If you panic, it doesn't help your breathing at all. And also try to help you get in deep breaths. Obviously, if you are having more difficulties and it's severe, you definitely want to go to the emergency room or call for help. Speak with your doctor. Remember, you always want to consult with your doctor for clarity and for information about exactly what to do. So general information, though, these are things that hopefully you already know, but reminding you to do these things and to, take advantage of things that you already know and actually do them. All right. So allergies can be, very bothersome for some people. And if it's making it hard for you to breathe, don't wait. There is treatment, there are options, find help. And if you're in the Houston area, we offer allergy testing, we offer asthma evaluations as well, and we offer personalized treatment plans at InTouch Primary Care. So if you're interested in allergy testing, allergy treatment, asthma evaluation, contact us with the information in the caption. I hope that's helpful. Have a great day.